I wanted to quickly just jump on to Substack and share a little bit about what we're seeing with influenza this year. Now, there's a couple of interesting and also frustrating and disheartening and worrying things about flu that we're seeing. First and foremost, the flu season is ramping up dramatically in early January. It actually started a little bit earlier than in previous years, which tracks with what we were seeing in the southern hemisphere earlier in 2025 is the flu season was earlier, and it is ramping up much more precipitously than in years past. This is thought to be because the predominant strain, the H3N2, there's a new subclass, um, clade K, which is causing more symptoms and has evolved enough that it is evading some of the past immune protection that we were all experiencing from previous bouts of the flu, from previous flu infections, and everything along those lines. Now, in the UK, which is a little bit further ahead than us symptom wise, they are seeing that the flu vaccine is effective, but not as effective as in years past at protecting against the more severe, long lasting, and hospitalization versions of influenza. So we are still recommending it, knowing that it's imperfect, but that if it keeps you out of the hospital, if it reduces fever by a day or two, if it keeps you from spreading it to all of your loved ones quite as severely, then it's probably still worth getting. One interesting side note that we don't usually see with influenza is the amount of vomiting and diarrhea that's going along with the flu. It's confusing because when people usually say they have the flu, they mean that they have vomiting or diarrhea, like the stomach flu, which isn't influenza at all. But this year, influenza, the respiratory bug that causes high fever, body aches, joint pain, difficulty breathing, dehydration, all those sorts of things, is also often starting with at least a day or two of vomiting and then sometimes with diarrhea as well. And that has been noted not just in our practice and around our community, but around the country too, that this H3N2 variant is having a lot more gastrointestinal symptoms and a lot higher and more prolonged fevers. So we're talking 102, 103, 104 for days and days rather than typically the more brief day or two of fever and then feeling crummy and all those sorts of things. And so that's certainly something that to watch for and to know about. Now, other things to know about the flu is there's already been a handful of pediatric deaths. Last year in 2024 through 2025, during that flu season, we had 280 pediatric deaths, which was the highest number of flu deaths since the swine flu epidemic in 2008 or 2009. And so we had the most pediatric deaths ever last year. And this year is shaping up to actually be worse than previous years when it comes to the burden of flu illness in the communities. And so, what we're telling patients is if your child gets the flu, if they are at high risk for more severe consequences, we're talking children under the age of 2, those with asthma, those with respiratory issues, those with neurological issues, that it's important to come in so we can swab and we can check. And if you have the flu, then we're more likely going to treat you with Tamiflu or Zofluza. Now, outside of those ranges, it can vary what our approach is depending on all the specific contexts of your child and your family, what we're going to actually recommend. In some cases, we will swab them. We'll do the Tamiflu or do the Zofluza. If they have other exposure, if their youngs went into the house, if they have relatives that are at high risk, those sorts of things. By and large, treatment for the flu, once you get the flu, is supportive cares, meaning if we're uncomfortable, we use ibuprofen if we're over 6 months of age or Tylenol for under 6 months of age to control our temperature. Now, it's not just like, let's just give them a bunch of pharmaceuticals and blah, 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 blah. When we have a fever and we're uncomfortable, our body is working harder, we're burning more metabolic energy. It's more difficult for our body and our immune system to actually fight the flu. If you're uncomfortable, it's worth treating with a pain medication. If your child is home from school and they have the flu and they're 103 and they're playing in the trampoline, let them be. If they're miserable and they're on the couch and 103 and they're breathing fast and hard because their metabolic rate is increased because they have a fever, give them some ibuprofen. The other things that we do is make sure that we're staying hydrated. So whatever fluids your child typically takes are best. If you're having difficulties with keeping them hydrated, then dilute apple juice is a great way to encourage hydration. Dilute, so half apple juice, half water, has been shown to protect from dehydration. It works as well as Pedialyte. It tastes better than Pedialyte. People usually have it on hand more likely than having to run to the store. If you've got some apple juice or something along those lines, you can certainly do that. And then watching our respiratory effort and respiratory work. This is where children can have more difficulties with the flu, is with difficulty breathing, hard, fast breathing, prolonged breathing, those sorts of things. And so that's something that we really focus on when it comes to managing influenza symptoms. Now, there have been a number of pediatric deaths already this year. Last year, there were a lot more than typical, where they had brain inflammation. And so, if your child is just run down and tired and those sorts of things, that is typical for the flu. If they're acting abnormally, if you can't wake them up like usual, if they're, I mean, obviously, you're going to go in if they're having a seizure or something along those lines. But if they're giving you more signs that something isn't right, it's worthwhile to go and talk with your doctor. Now, none of this is to try to scare you, but it is to try to illustrate that the flu is serious and we take it seriously. And we oftentimes, it's like ibuprofen fluids. We'll check in tomorrow and see how we're doing. But as a broad public health measure, it's good to avoid influenza. The last thing that I'll say, and I just heard this and shared this on my Instagram recently, is that children get the flu, very likely to survive. Adults get the flu, by and large, very likely to survive. The elderly, if the elderly get the flu and they survive getting the flu, which most of them still do, they are at a higher risk for death in the next 6 months, even though they got through their flu. Part of the body, having its toll taken, the ongoing inflammation puts them at higher risk for heart attacks and for strokes for 6 months after getting the flu. And so we know that influenza and other viral illnesses cause the, temporary runny nose, cough, congestion, fever, all those sorts of things. But especially for that elderly group, the grandparents group, it puts them at a higher risk for stroke and a higher risk for heart attack and death for the next 6 months after getting it. Hopefully, this has been helpful. Drop your questions below. Would love to answer them and help you to make sense of your child's health and what you can do to help them stay healthy.